Can you tell me a bit more about the Video Information Project, which uses QR codes for access?
Yes, so I have led on a project which is very innovative and very exciting. We've worked in partnership with Dr. James Ohindershan, who is in the computing department at Goldsmiths University. And essentially, it is the use of the technology of QR codes to develop emotionally engaging videos to deliver medicines information to our service users, carers, as well as other healthcare professionals. The videos can be accessed by a number of ways, and not only with QR codes, but also we attach them to medicine packaging and also via a website that we have created with different channels for different medications, as well as our electronic prescribing system. They also, we've collaborated with the Choice and Medication colleagues, and actually they are available for healthcare professionals on that website. They do have subtitles and also facility for translations as well. We particularly looked at high-risk mental health medications, of which Yogi was instrumental in the production and creation of those videos, including the acting in them as well. And this was obviously, we carried out the videos with valproate, given the pregnancy prevention program, to really help people to understand about valproate and the risks and enhance the safety around it.
Well, that's very exciting. So what would a patient see and how would they use it?
Where we have medication dispensed at our services, these are provided to all our patients. And when they receive their medication, on the packaging, and Yogi's mentioned that it's the original packaging for valproate, we add a sticker which says, please read for further information. So we're not only relying on the physical patient information leaflet, we are enabling patients to scan the QR code, link straight to the video, has some narrative about valproate and the risks that Yogi's outlined, as well as a dialogue which makes it really emotionally engaging, because it's a conversation between a pharmacist and a patient, asking questions about what to expect with valproate, what the risks are, so that they really know what they're being prescribed and the risks around it. Essentially, that's how they access. However, they can actually find it on our website as well.
That sounds terrific. How did you develop the content?
We actually, as we've mentioned, it's a co-production. So Yogi leads in a group, which is a medicines for mental health co-production group. We have excellent, really helpful carers and service users on that group. And they actually help to script the videos. So we're not doing it as healthcare professionals thinking about what people need to know, but it's real co-production.
And what challenges did you face in doing this?
The main challenge is around the translations. We have got the facility now of, I mentioned about the English subtitles, but we have most commonly spoken languages in our organization available. However, the text, when it's translated, as we know, it doesn't always accurately reflect the language. So we are struggling, obviously, with our funds to actually look at getting those all translated accurately. So in essence, they do have access to the different languages, but we need to sort of refine those. And that's one of the challenges. The other challenges was to help people understand the concept. So that's why we're really, even though it's gone through our sort of governance processes and approved within our organization, really now is to approach the MHRA and pharma to really acknowledge that this form of medicines information would be really helpful, because we've had extremely positive feedback, not only from service users and carers, but also our healthcare professionals, because it could also be used as a tool for training. So, for example, if a practitioner was not unsure about all the facts around the pregnancy prevention program and what needs to be included in that conversation, this is there to support them as well. We have a green plan within our organisation to really look at what we can do to contribute to the green plan. And actually, we've also sort of ticked that box in that on the actual video, for example, of valproate, we actually have a link to the patient information leaflet. So if people didn't really, well, even though they'll have it in their package, but they can access the written information via the link as well.
That's interesting. You mentioned the language issue. What are the most commonly required languages?
Within our organisation, we have a huge demographic and a very diverse population. And analysis shows us the most recent is Hindi, Spanish, French, Arabic, Bangladeshi, Mandarin Chinese, and Russian.